Welcome back to the Woman Factor. Joining us tonight is again Dr. Fail, a cardiologist at the Cardiovascular Institute of the South, and Kim Waldrup and Jeanne Caldarera, two TGMC patients who experienced heart complications. So Kim and Jeanne, talking about the risk factors such as high cholesterol, high blood pressure, did either of you meet any of these risk factors? Did you feel unhealthy before the diagnosis? Kim, we'll start with you.
No, I didn't feel unhealthy. I ate well and took care of myself, so I felt that I was healthy, but I did have high cholesterol, and I knew that it had been high for approximately 6 years. My family physician wanted to put me on cholesterol medications, but I resisted because I was afraid of the side effects. You hear a lot of people talk about side effects, but I soon learned that the side effects of a heart attack are much worse than the side effects of cholesterol medications. Those medications can cause problems, but my advice would be work with your physician until you find the right one that works for you. There are many cholesterol medications on the market, and if you work with your doctor, they will find the one that's perfect for you, and I have done that. And my cholesterol is under control now. 3 weeks prior to the heart attack, it was 290 total cholesterol.
Wow. And Ms. Jeanne, what about you?
I had low bad cholesterol and high good cholesterol. I had low blood pressure. I wasn't overweight. I didn't have any family history of this particular heart malady. They ended up thinking that it was probably a birth defect. So, no, I had nothing.
Wow.
And
It's kind of
I didn't
scary.
have any of the markers.
No symptoms or anything. And Dr. Fail, what can women do to reduce their risk?
Same thing we tell men, don't smoke.
Is that the number one
Number one,
thing?
don't smoke. Do not smoke. It definitely quadruples your risk, smoking. So that is the number one risk factor that you can truly modify and say we need to do something about it. And so, the patients come to see me and, I'm smoking, let's figure out what we got to do. There's a Louisiana Trust that helps people get off cigarettes, so absolutely don't smoke. Watch your weight, exercise. We talked last week about Fitbits, get a Fitbit, start doing your 10,000 steps. Those are all important things to do. Diabetic control, making sure that your blood sugars are controlled, make sure your cholesterol is under control. 290 is obviously way too high. And like Kim said, I think when we see patients in the office, the first problem, I don't want to do that medicine because I hear such bad things. What you don't hear is about the person who had the heart attack or the person who died from the heart attack that wasn't on the medication, and that's the other end of the coin. It's very easy to watch the commercials and berate the drugs and say the drugs are bad for you. You don't hear the success stories, and that's the problem. Good news doesn't sell, and so you don't hear the success. And realizing that, not to do a brand name, but atorvastatin, which was Lipitor before it went generic, was one of the highest prescribed medications in the United States. There's a reason for it. Number one, it's a good medication. It gets people's cholesterol. And number two, people need to be on the medication to get the cholesterol under control.
So even with all the symptoms maybe that patients may experience from these medicines, it is recommended that you get
I think Kim put it out very nicely, is that there is quite a few different cholesterol medications, and you can take a bath in one and can't look at the other without having side effects. And so it really is a matter of not just denigrating all of the statins and say, I can't take that, I tried one, it doesn't work. It's there is a different biochemical process, and say, I can try this one, it didn't work for me, it caused muscle cramps, I can try this one, I didn't like it because of upset stomach, I tried this one and it worked. And that's really what you really need to do. If you need to get your cholesterol down, you literally need to go through every one of them and say, okay, finally I've got this one that gets my cholesterol under control and it doesn't have a side effect. You can't take an aspirin without having side effects. I mean, there's everything that you take on a day-to-day basis has some level of side effect. Most of them, 99%, are tolerable. Some of them are not, and it's important to work through to find the one that you can say, I can take this and still be effective.
And Kim, did you identify with having any of these mentioned risk factors? Did you make any significant lifestyle changes after your diagnosis?
Well, basically, I lived a good life before. I ate well and took care of myself, but I think everyone can tweak their lifestyle. I work harder at eating well. I'm always trying new recipes that are heart healthy and that taste good. I work more towards exercise. Exercise is something I've always hated, but I've been able to form a love affair with my treadmill, and it helps me to get my steps in. I can watch TV or I can read while I'm on the treadmill, so I can multitask, and that makes that easier. I would say, and the other thing is I take my medications as directed, and I see my cardiologist every 6 months for checkups, and I'm faithful about that, and they keep me on track.
Good. And Ms. Jeanne, what about you? Did you make any significant lifestyle changes?
No, I didn't. And it made me laugh because I was the only heart patient that I knew of at the time. But the doctor came in and said, whatever you do, do not change your lifestyle. And because he said you were over 99% blocked in your LAD, but you didn't have a spot of anything anywhere, nowhere else. You know, your blood pressure, they said just keep that up. Also, I've taken a baby aspirin for years, and they said that's really what saved me, because I had a plaque rupture, but it didn't clot. So I've always done, so no, I really have not made a significant change. I take a very small half of a dose of atorvastatin at night just to keep the stent from closing up. Other than that, no. And I have been fortunate. I felt great in the cath lab. You know, so I'm really an oddity. I know that.
We like people to feel good in the cath. We go for that.
And I
That's
did.
the
I felt
experience
very
we
good.
want to go for.
So all three of you, though, mentioned about exercise, definitely an important thing, correct?
Correct.
And I know, working out and everything, you can track your heart rate, correct? How important is that? Is that a big factor in exercise, tracking your heart rate, or does that really matter?
The standard is 220 minus your age.
Okay.
And that's basically your max heart rate, but it doesn't mean you can't go over it. And then you do 85% of that, and that's sort of a target burn where you want to try to achieve that to do some level of aerobics. But there's no magic number that says I need to be here. I mean, just, it's more about doing the exercise than more to get your heart rate elevated. And so going out for a walk, I mean, the 10,000 step, didn't say 10,000 jogging steps, it was basically 10,000 steps to go walking. That's more important in being active. There's very good data that shows that there is a J curve, that you can actually exercise too much, that there is a harmful effect to too much exercise. And truly, I don't think any of us really have to be worried about that. There are very few people who have to worry about the too much exercise. But there is a harmful or downside effect to too much. But realistically, I mean, if you go out for a walk in the morning, you do your 2 miles, your 10,000 steps, you just stay engaged and active. That's most important.
Well, definitely a lot of information on exercise and the benefits of that. Very good. Well, we need to take a quick break. We'll be right back. We'll be right back after these messages from our sponsors.